So, good afternoon, everyone. I am Gloria Watkins, Federal Project Officer and BCP Coordinator. I actually work out of the central office in Washington, D.C., and on behalf of the RHY Division Director, Dr. Sanzana Dean, we are elated to be able to present this Basic Center program training to you. So much work has gone into designing the training to specifically meet your needs. And we are so happy that so many of you are present with us today. So as you all heard our opening theme music, One Nation Under a Groove, I hope that you've been kind of feeling the vibe and the energy that goes along with that song, because our position with the BCP work group is that we are one team helping RHY across the nation. So ready or not, here we come, getting down for the ones that we believe in. So with today's training, our goal continues to be that of working to end youth homelessness and to improve outcomes for youth. And together, the collective, we can do just that. Now, before I sing to you all anymore, or before I share any housekeeping information or highlight the training timeline, I'd like to first present FSBE's new Associate Commissioner, Kimberly Waller, who will provide some opening remarks. Now, might I add, Kimberly may not sing to you, but she is just as excited as we are about the work and improving outcomes for young people. So Kimberly, are you ready?
I am. And Gloria, you should have mentioned that there was a singing component to this introduction. But thank you so much, Gloria. It's so wonderful to be here with everybody. What a great introduction. The music, Gloria, your introduction just made my heart really happy. So welcome, everybody. Welcome, grantees, to the 2022 Runaway and Homeless Youth Program Specific Training Series. As Gloria mentioned, my name is Kimberly Waller, and I recently, I'm going to say, rejoined the Family and Youth Services Bureau as the Associate Commissioner. I was with FSBE as a policy advisor from 2016 to 2018, so maybe had the opportunity to meet many of you. But if not, really looking forward to hopefully meeting you soon and throughout the years while I'm in this role. And it was during that time where I really learned firsthand the vital importance of the Runaway and Homeless Youth programs to prevent and respond to youth experiencing homelessness. And I'm super excited to be back and really excited to be with this wonderful group of people here today. I see there are 475 people on the call. So just welcome, welcome, welcome. And truly already motivated daily by the work that you all are doing, the transformative accomplishments that I'm seeing across our RHY grantees and the RHY team. And I, of course, wanted to take a quick moment to share with you a few of FSBE's priorities over the coming years, many of which you all are doing in the community already, and really excited to do this work in partnership with you over the years. So I have four priorities that I have shared with FSBE colleagues since joining the team. Again, many of these are not going to be new to you and the work that you're doing. But the first is really FSBE believes in the importance of coordination and collaboration efforts across federal, state, and local partners. Working together will ultimately allow us to accomplish more than what we can do alone. And as Basic Center programs, I know that you all are intimately familiar with this. FSBE is also committed to ensuring that our work is grounded in equity and inclusion. In February, so last month, aligning with Black History Month, FSBE launched an initiative to develop a FSBE Racial Equity Action Plan. We know you have been engaged in similar efforts within your organizations across the country, and we're really excited to drive this work forward with you. And FSBE will lead in partnership with youth who have lived expertise of experiencing homelessness and who have participated in FSBE programs and RHY services. Lifting up all voices who have the knowledge and experience to guide FSBE's ongoing work to address and respond to homelessness and housing instability is truly our path forward to finding solutions. And lastly, FSBE will drive our work using a data-driven decision-making approach. Policy development and programming must be influenced by data and outcomes. Services should be responsive to the needs of our communities. And of course, we must track outcomes to highlight what is working really well, which I know we're going to share some of those today, and be able to rethink what may need to be changed going forward. So, of course, I have the privilege of welcoming you today to this great opportunity to develop new knowledge and skills for delivering RHY programming. We have a really great lineup of presenters and sessions during our time today. And it's really, the time is structured today to provide balance between presentations. I'm super excited about the grantee spotlights. That's my favorite. And then an opportunity to do some group breakout discussions, which I know in these kind of virtual platforms are a really good way for you all to learn together and learn from each other. And although the training is being conducted virtually, we really encourage you to be active participants in our training activities. There's the chat function and alternative ways to have your voice heard, and we really want to hear from you. These trainings sessions really provide an opportunity for each of you to share your newfound knowledge with your colleagues. So take what you've learned here today, bring it back, and so that ultimately the knowledge gained here today results in our program participants becoming the greatest benefactors of the collective efforts here today. Want to take a moment, of course, to recognize our RHY training and technical assistance partner, RITEC, which is Youth Collaboratory, for their partnership and expertise in hosting these sessions. There's a lot of work that goes into planning and logistics of something like this, and we're very appreciative for the support. And in addition, of course, I'd like to extend my thanks to all our grantees and to the fantastic RHY team for their work in coordinating and planning this event. Your compassion, dedication, and commitment to this work continue to have a long-lasting impact on young people's lives that we serve on a day-to-day basis. Once again, thank you for your time, for your commitment and dedication to your communities and the youth that you serve. And I'm going to turn it back over to Gloria for hopefully some more song. But thank you all so much. And I hope that you have a great training today.
Thank you, Kimberly, so much. It's always a pleasure for us to be able to hear from our leadership and just to get the support that we have. So thank you so very much. I'm not going to delay this point, and I'm not going to sing to you right now, but I would like to share a few housekeeping items with you. So participants will be directed to put any questions that you have into a chat, which will be monitored by our RITEC support staff in the way of John McGaugh and Diamond Dumas. We will also have our federal project officers, Alicia Proctor and Sharon Boyd, who will be responsive to the questions in the chat. If time permits, at the end of this phase of the training, we will allow for some live questions to be posed. But again, we'll make that decision closer to the end of the program requirements segment. However, if we don't have time, this training will be recorded, and all questions that are asked, a document will be put together and disseminated to all of you following the training. Closed captions will be available for the duration of this training, and the slide deck will be provided to you via the RITEC website. You'll also receive an email after the event with the link to the slide deck. Training recordings will also be available on the e-learning platform on March the 30th. And lastly, please, please, please do not disconnect from the Zoom platform when we take any type of break. We want to make certain that everyone is connected and there are no significant delays or anything to impede your ability to be a part of this training. So those are the housekeeping items, but I would also like to outline the training timeline for today. We have two segments to our training. The first part is the program requirements piece that is expected to conclude around 2:30. We will then take a 15-minute break from 2:30 to 2:45, at which time you will go out or go into your breakout sessions, and you will be there from 2:45 to 3:30. You will then return to the main group or the main room at 3:30, and for about 20 minutes, we will have a report out by our breakout groups. Thereafter, we will have some updates from RITEC around the training evaluation, and then the last voice that you will hear will be that of our division director, Dr. Sanzana, Dean. So the training today will be presented by three of our esteemed colleagues in the way of Patrina Winston, Danny Balcom, and Angelica Gutierrez. The purpose for today's training is to allow for understanding and to discuss key program-specific requirements, to learn strategies to improve and enhance outcomes, as well as to effectively enable you to serve the youth in your programs. And lastly, you will develop and strengthen partnerships with colleagues in the RHY field. Next slide, please. Our agenda today includes some discussion around legislative authority and the purpose of our programs. You will hear more about our project goal, the BCP project goal and vision. Some definitions, key definitions will be outlined along with you. We will also have a deeper dive around the Basic Center program requirements. And then lastly, we will address some national program administration requirements. So at this time, I would like to turn it over to my colleague, Patrina Winston. Patrina?
Hello, everyone. My name is Patrina Winston, and I am the Federal Project Officer from the Region 9 San Francisco office, along with my two amazing colleagues, Deborah Oppenheim and Angelica Gutierrez. I'm just going to jump right in because we have a lot of information to cover. Okay, so legislative authority. So FISB funds the Basic Center program under the provisions of the Runaway and Homeless Youth Act. Here we have a set of laws from the Runaway and Homeless Youth Act that relates to the Basic Center program. These laws were originally passed in 1974, and since then they've been reauthorized multiple times. I think the RHY Act was most recently reauthorized by the Juvenile Justice Reform Act of 2018. Next slide. So here we have more laws that cover requirements regarding the Basic Center shelter, locations, capacity requirements, staffing. Next slide, please. And the development of strategic plans for addressing runaway and homeless youth that comes from other governing systems such as foster care and correctional institutions. So I just want to mention here that most of these items will be discussed throughout the presentation. Next slide, please. And now we have our Basic Center program definitions. Next slide. So important BCP related definitions. So the next few slides list the terms and definitions related to the Basic Center program. And this will help to clarify runaway and homeless youth expectations and requirements. Again, most of these words that we use throughout this presentation, we're going to use them. So I'm just going to try to get through them quickly. So here, there are a few significant terms that are officially defined in accordance with the statutory language from the RHY Act for the purpose of the Basic Center program eligibility. First, we have homeless youth, and homeless youth is an individual under the age of 21 and has no other safe alternative living arrangements. And then next we have runaway youth, and that's an individual that's under the age of 18 who has run away from home without the permission of a parent or legal guardian. So there's a difference between the two. Next slide, please. And then we have street youth, and that's a runaway and homeless youth under the age of 21 that lives in the street or spends a lot of time in the street and other areas that can increase the likelihood of youth substance abuse. And then we have preventative services, and that's defined as services provided to a youth and or a youth's family prior to residential stay and after at least 3 months of aftercare. Next slide, please. Street-based services. So street-based services are services that are provided to youths on the street in areas where they often meet. Street-based services are designed to connect runaway, homeless, and street youth to the services offered in the Basic Center programs, as well as assist them in making healthy choices. And then we have outreach. And so outreach, it involves identifying and reaching out to the vulnerable RHY population and providing them with immediate support services and information about your BCP program and benefits that are available to get them off the street. Next slide, please. And then we have shelter. And shelter is a basic center program shelter that provides runaway and homeless youth with room and board, crisis intervention, counseling, and other services on a 24-hour basis up to 21 days. And here we have respite care. So respite care is when short-term child care services are offered to parents and other child caregivers or caregivers for temporary relief. And then we have host family home. And that is a family or a single adult home or a domicile that provides shelter to a homeless youth. Excuse me. So, and please note the family of a host home family, the family must be other than that of a parent or a permanent legal guardian. Next slide. Crisis stabilization services, and that's the direct services that provide intensive short-term mental health care to people experiencing a severe crisis that's associated with substance use or mental health conditions. Gateway services are services that are typically provided during outreach, and it involves outreach workers developing good rapport with runaway and homeless youth by giving them items such as foods and drinks, clothing, and survival packs to meet their basic and immediate needs. And lastly, we have aftercare. Aftercare is additional support services provided to a youth after they leave the Basic Center program, covering at least 3 months. Next slide. Harm reduction. Harm reduction are their basic needs and services that are aimed to reduce harmful and negative high-risk behaviors. And this includes reducing the risk of sexual exploitation and human trafficking and substance use. And then lastly, we have follow-up services. And follow-up services is to track the progress of youth after receiving a referral. Next slide. So now we have the Basic Center program, Project Golden Vision. Next slide, please. And the goal of the Basic Center program is to provide a positive and safe alternative for runaway and homeless youth, and to assist them in maximizing their potential while taking full advantage of the available shelter and non-shelter services. The Basic Center program provides a number of services such as temporary shelter, food, clothing, counseling, and referrals for healthcare to youth under the age of 18 years old who have run away from home or have been forced to leave home, or even who have ended up in contact with law enforcement or child welfare or mental health or any of the systems, juvenile justice systems. And so the vision for the Basic Center program is to help and strengthen community-based organizations that meet the immediate needs of runaway and homeless street youth and their families. The Basic Center program focuses on family reunification by reuniting young people with their families. And if that's not a possibility, the program will then explore locating safe alternative placements for youth. Next slide, please. And so here we have the Basic Center program requirements. Next slide. And so the 4 basic program requirements that we will cover today is shelter and counseling, comprehensive youth-centered service models, performance standards, and sustainability plan. Next slide. Shelter and counseling. Okay, so first we have shelter and counseling. Next slide, please. Okay, we have shelter and counseling, and under this is the sub-requirement, grantee shelter requirements. And here we are, we're talking about your emergency shelter. So, you know, your Basic Center shelter must be open, adequately staffed and supervised all day, every day. That's 24 hours a day, 7 days a week. And staff must be present and youths must be supervised. There's a minimum of 4 beds, no more than 20 beds requirement in a single structure. And this also applies to the Basic Center programs that utilize host homes as a residential emergency shelter. The host home must also have a space to accommodate a minimum of 4 beds for 4 use, or a grantee can utilize multiple host homes to meet the minimum requirement. So if you have 2 host homes, 2 of those host homes could have 2 beds in each homes, or you could have 4 host homes with 1 bed in each homes. It's important that you meet the minimum requirement. But keep in mind, whatever number you list in your original application about the total number of beds, that is the number that we hold you to. Okay, your residential facility must meet all the applicable state licensing requirements and standards. You must ensure that all the shelters that you operate, including your host home families, are licensed. This also applies to any shelters that you regularly refer clients to. They must have evidence of their current license issued by the state, and or localities with licensure requirements. Grantees are also required to use a positive youth development framework. And that's, they should use that as a foundation for providing services, and it should be incorporated into all aspects of the grant program. And this includes healthy messages, safe and structured places, adult role models, skill development, and opportunities to serve others. I have gone out on monitoring visits, and I have seen some very creative, innovative, positive youth development approaches. And, I remember a grantee, they had their youths paint a mural with positive affirmations on the walls. That was a BCP program. I've seen it where all youth were given like very huge oversized duffel bags for their clothes, so they didn't have them in garbage bags. And that was with a street outreach drop-in center. And another grantee used art. They used art as a way to promote and encourage, positive youth development frameworks. And that was with a maternity group home. And this is where they actually had the spoken word every Friday, where youths could express themselves through poetry and music. And it was just incredible. So there are a lot of things that you can do to utilize a PYD framework. Another PYD approach, and this is my last example, is to just a recommendation to get away from an institutionalized setting and make your program have a more home-like feel, very warm home-like feel if you can. And you can do that by putting pictures up on the wall. I've seen pillows on couches, artwork. And so these are things that can, give a youth a sense of safety and belonging. Okay, and so since your Basic Center program is serving minors, you must contact a youth's parents, legal guardians, or other relatives as soon as it's feasible, but it should not be any later than 72 hours of the youth entering the program. Grantees, you must have a documented emergency preparedness plan, and that addresses steps to take in case of a local or national situation that poses a risk of health and safety to your staff and to your youth in your program. This plan should also include contacting your federal project officer or grants management officer when evacuation plans are executed. Lastly, we have safe and appropriate exits. Your Basic Center program must ensure that youths have safe and appropriate exits when leaving the shelter program and are going to a referral or a relative. Next slide, please. And so now we have not respite care. So I'd like to talk a little bit about clarifying the RHY program expectations as it relates to respite care. And so, the question I have is, can a parent or legal guardian drop their child off at a Basic Center program because they're not getting along? or because they can't take it anymore, or because they've had enough. And so that's a rhetorical question. I'll answer that. No, they cannot. And here's why. If we go back to the definition of runaway, it is when a youth absents themselves from home without the permission of a parent. And so it's the whole notion of choice that matters in this definition. A runaway is not someone who is brought into a basic center program by a parent for emergency care or services because it benefits them. So therefore, grantees cannot use basic center program funding for respite care. However, if a youth is a runaway from home or is forced to leave home and has no other safe places to go, and then they're considered homeless and they can receive services. Next slide, please. Human trafficking. So the runaway and homeless youth, street youth, you know, they are at a much greater risk for sex and labor trafficking, much more than other populations, because they are amongst the most vulnerable and they can quickly become targets. So, and that is why it's very important for basic center program grantees, you know, it's important that they are prepared and they're trained to identify, interact with, and service youth that are victims of human trafficking and other types of abusive situations. I like to place special emphasis on the words prepared and trained, but the problem is grantees, you know, they may not always have the resources to prepare and train their staff to become experts or to develop and implement a user-friendly instrument to screen youth for trafficking. Well, in 2019, a FISB grantee Covenant House introduced a new screening tool for the for runaway and homeless youth based on the study they conducted with Covenant House, New Jersey, and some other youth service providers. So this instrument, called the Quick Youth Indicators for Trafficking, QYIT, was developed based on 5 questions from the Trafficking Victim Identification Tool, and that's TVIT. And that's a tool that experts use, which takes about an hour to complete. And, you know, we all know in this world that an hour to complete a tool that's a very long time for a runaway and homeless youth. So Covenant House, they created this new screening tool with only 5 questions that have the highest odds for determining if a youth have been trafficked based on their life experiences. And so the Quick Youth Indicators for Trafficking can be used by grantees to detect and serve runaway and homeless youth with labor or sex trafficking experiences. So I strongly encourage you all to go to the FISB resource page and look up human trafficking and youth servicing programs, a blueprint for organizations working with street youth, homeless youth, and youth at risk. And so this is where researchers identified 3 major steps that youth serving organizations can take to better serve this population. And so we will place those links in the chat so that you're able to refer to them. Next slide, please. Okay, shelter and counseling, grantee counseling requirements. So, you know, grantees must have a plan for providing residential and non-residential counseling services to runaway and homeless youth and their families based on their needs. For example, it can be to encourage family reunification, to strengthen family relationships, encourage stable living conditions, and help in the resolution of a intra-family problem. Counseling services, which can be individual, family, or group, they're designed to help alleviate the problems that contributed to the youth running away from home or being homeless. And the objective is to help them decide upon a future course of action. Treatment, counseling, and prevention and education programs must be available to all youth in your Basic Center program for up to 21 days. And it should be integrated into the youth service plan. That's very important to remember. Please note, assessments are not counseling sessions. And lastly, medical, psychiatric, and psychological treatments require a youth's consent, as well as the consent of their parent or legal guardian, unless, of course, the youths are in harm to themselves or others. Next slide. So finally, we have optional services. And so you may choose to provide the following optional services in your Basic Center program. And I will try to get through these quickly because they're very extensive. But first, we have street-based services, and that involves conducting outreach activities for runaway and homeless youth and street youth. There's other requirements that apply to staffing, and they are quickly to provide qualified supervision to outreach staff, including on-street supervision by appropriately trained staff. You should make sure that there is backup personnel for outreach staff. Most street outreach services are conducted with a minimum of 2 people. Staff should never be alone. Provide initial and periodic training to staff who conduct street-based services. Next, we have home-based services for families with youth at risk of separation from the family. And that's basically, those are services that consist of providing counseling and information to youth and their families. And this includes services relating to basic life skills, interpersonal skill building, educational advancement, job attainment skills, mental and physical health care, parenting skills, financial planning, and other sources of needed services. And under this home-based services, you must be able to provide 24-hour to respond to a family crisis. Next, we have drug abuse education and prevention services. And, that's just where grantees should provide drug abuse education and prevention services to runaway and homeless youth in the program. And the requirements includes, a plan that lists a description of the type of services that will be provided in their objective, and a description of the types of information and training that will be provided to staff that deliver these runaway and homeless, these services to runaway and homeless youth. And then there's testing for sexually transmitted diseases, and this involves the grantee offering testing for sexually transmitted diseases at the request of runaway and homeless youth. Okay, and so now I would like to pass the baton to my very esteemed colleague, Danny Balcom. Take it away, Danny.
All right, thank you. Esteemed, very kind. I appreciate that. All right, good afternoon, good morning. My name is Danny Balcom. I'm one of 2 federal project officers located in New York City. I'm assigned to Region 2, which consists of New York, New Jersey, and Puerto Rico. If any of my Region 2 grantees are on the line, I'd appreciate a hi or let me know that you're here, so I know that you're with me. All right. Before I get started, I just like to go over a few things. I saw, thank you, Paula. I saw some questions about the slides. Just a reminder, you guys will get slides. I appreciate this. Good. All right, and you'll get copies of it. Also, I appreciate class participation. So please, please, please put comments in the section in the chat. We have a wide range of grantees on the call today. We have grantees who have had the FISB BCP for quite some time and they're very experienced. We also have some first-time BCP grantees as well. This would be an opportunity to do some peer sharing. As Commissioner Waller mentioned, you have an opportunity to share amongst one another and just to talk to each other. During the time that you see that a grantee has put out something that you like to know more of, please, instant message them, give them your contact, ask them, can you follow up with them at a later date and time? One thing that I noticed about the grantees in Region 2 and even the grantees in Region 1, when I was assigned to them for a brief period of time, they like to share. You guys like to help one another, and I definitely appreciate that. So with that being said, let's move on to the next slide, please. These are the subject areas that we're going to cover during my portion of the presentation. You can see they're up on the screen. I am not going to read to you personally. I just don't do that. You know, you have the opportunity to read. You can read more in detail when you get the slides assigned to them. I like for the conversation to be as organic as possible. All right, so next slide, please. All right, trauma-informed approach. We all know that many of the youth who come into the BCP program and who we might have encountered throughout our years of experience have experienced some form of trauma over another. They've been involved in different systems throughout the years. You know, you name it, they might have experienced it. It's very important for us as providers to be aware of this so we can recognize the symptoms of trauma. And it's important because what you don't want to do is have somebody come into your program and you re-traumatize them, all right? And ways of being able to identify this is to make sure that staff is adequately trained. If you are not aware of certain trauma-informed trainings and approaches, you can reach out to your FPO. We'll reach out to RITEC. We'll try to get you connected with different providers who provide trauma-informed trainings. Right? You want to promote a safe, healing environment. They mentioned, Katrina had mentioned earlier, you want to make your environment as homely as possible. I understand that people have different, grantees have different resources, and some are able to present their BCP in such a way that it is like a home, and some aren't. But what I've noticed in doing site reviews is that the staff that I've encountered, their personalities have made the environment warm and welcoming. And you know you have such an environment when you have kids that are referring their friends to your program. You know, positive youth development. And using PYD, you know, we're trying to send healthy messages to you. You know, we're also trying to promote leadership. You know, there are different ways in which you could promote PYD in your program. You know, there are several grantees who I've encountered that have a youth advisory board. You know, the youth advisory board has helped them many ways, and one of the best ways is to help them provide better services to the youth in the community. You know, they also have ways of developing the ISLs. I'm sorry, the independent living skills. Right. And in doing so, I've encountered grantees such as St. Anne's in Albany, New York, and Wayside in Massachusetts, where they've had chefs come in, nutritionists come in and help the youth learn how to shop using, being able to read labels. One of the workers, her name slips me at the moment, at St. Anne's, showed the youth how to utilize, when they go shopping, to purchase only what they need. You know, that's a twofold skill build. All right. You help them to shop wisely, but you also help them to be efficient in using their money and making sure they buy what they need. I did not know that you can go into the store, in certain stores, and buy spices according to what you need, by the teaspoon, by the tablespoon. I go in, I buy a big thing of McCormick, and it stays in my counter for God knows how long. All right. See, somebody else, they were taught to shop wisely too, and it benefits. All right, it benefits you tremendously. It's something that stays with you for a long time. You know, we've had grantees that they would come in and have people come in and teach the youth financial management. You know, you're helping them to take charge of their life and be more responsible. You know, you're also showing them, you know, in doing financial management that, you know, you have to start somewhere. You know, I know we're talking about BCPs, but I have a TLP here in Long Island where they have grants, the youth have jobs, and they actually have plaques on their wall where they show how much money they saved once they've left the agency. And it's a motivator for the other youth who are behind to help to save money. You know, it's not a, you know, rubbing your face thing. It's a motivator. You know, if they did it, I can do it as well. But these are some positive youth development skills that can be used. I'm actually interested. See, 29,000 is the highest from Andrea. See, I'm impressed. I don't know if any. I don't have 29,000 in my account, so I'm very impressed. I'm just curious. You know, earlier I said I want to see class participation. I'm seeing things go up in the chat. What are some of the positive youth development skills that you're using at your agency? I'll wait just a minute to see if anybody's going to put anything in what they're doing. Okay. Wellness program, great. Interviewing new staff, that's excellent technique. Having them interviewing new staff, it helps to make sure that they're the right fit. Hip hop therapy, all right. Grocery runs, music studios, this is great. Nutritionists, excellent. Medication, art therapy. I love art therapy. Those that know me know I'm a freelance photographer. I love art therapy. Actually, Wayside, to go back to them, they have an art therapy program in their drop-in center that's very helpful. And I've come across several others as well. Meal planning, groups and outings, gardening. These are all excellent ways of getting youth to develop their skills level. This is excellent. Thank you. All right, next slide, please. Public outreach and awareness. This is a subject area that I like very much. This is a subject area where I was actually told I'm old. I know I have some gray hairs here, but you know, I don't claim being old. I grew up with the Toys R Us era. You know, you're a Toys R Us kid, you don't want to grow up. That's me. All right. And what I mean by that is that when I was talking to the agency about, I'm with you. Thank you, Carla. You know, when I was talking to the agencies about different ways that they do outreach, right? A lot of agencies nowadays are using social media, right? And social media is a wide platform. And I was told I was old because the first thing I brought up was Facebook. And they said, you know what? Old people, adults use Facebook. Well, I like Facebook, so I guess I'm old, so I'll accept that. But you, in doing your outreach, you have to understand the population that you're trying to target. All right, if you're utilizing social media, if you're trying to get through to youth, you got to find the platform that they use the most. All right, nowadays, you know, you see kids on TikTok, you see them somewhat on Instagram. All right, I'm pretty sure there are quite other. What are some of the other platforms that the youth are using other than TikTok? And the way that the Snapchat, Twitter, okay, Instagram. I'm glad you brought up Instagram, because what you can, Reddit, all right. With TikTok, you can actually do a TikTok, push it over to Instagram, and then from Instagram, push it over to Facebook, in which case you can hit 3 platforms with one upload. Now, again, what you got to be mindful of the population that you're trying to target. So you're not going to try and target your community provider, your network, your doctors, your legal services with a TikTok that's geared towards you. All right. At the same time, you're not going to have that, Facebook post geared towards the kids. What we found that is helpful is that some agencies, as I mentioned before, are more experienced and a little larger than others, is that CHD in Massachusetts has a marketing department. Oswego uses their digital media department. Anchor House in New Jersey. One of the best ways that I've seen so far, and I push this a lot, is they use QR codes. They put all the information into the QR code, so then that way, when the youth walks by with their phone and they see the QR code, they click on it. It's a digital footprint on their phone. They keep it with them. It's like having a digital business card. Excuse me. Compass House here in New York has a marketing and communications committee. So what is some of the way? All right, so I see Christina likes the QR code idea. That's great. You have to be creative in trying to conduct your outreach. All right, and being creative, and I've said this before with a pre-pandemic to a lot of my grantees, it's important to try to think outside of the box when trying to especially get through to youth. Well, now that we're in pandemic or ending pandemic, that box has kind of been redefined. And we have to think a little bit more outside of that new parameters that we have. So how can we get through to them? All right. One of the ways that I think is a good way to get through to them is to use youth themselves to help you structure your outreach. Earlier I mentioned about, positive youth development, and agencies have youth advisory boards. You can access the youth on your advisory board to help you set up the content for your outreach. You can go to colleges. A lot of grantees have social work interns or mental health interns that work with them. Leverage your resources with the college and see if you can access their digital media department. See if you can get students who can help you structure your content so you're more effective in doing your outreach. Again, trying to be as creative as possible. Okay, outreach. Okay. Outreach teams go to food courts. All right. So, and this is the reason why I really like the outreach part, and I'm talking about the social media aspect of it, is that a lot of times that I've seen when I've gone on site reviews, when I ask what type of outreach that you've done, they've done one type of outreach where it's just public outreach and doing tabling, community providers. When you look at the social media, they're targeting one group. It's important that you have a BCP outreach plan, because you got to remember in the NOFA, the Notice of Funding Announcement, it says that you have to have a plan where you actively seek out youth, actively. So that means that you would have to go out there and do some type of face-to-face contact. And I can hear people saying, well, how do you do face-to-face contact in a pandemic? A lot of grantees continue to do it. They take safety measures, they use masks, they used visors in the heart of the pandemic, and went out and still did face-to-face contact with the youth. What that did for those grantees is that strengthened their credibility with the youth in the community. In the middle of a pandemic, you did not forget about us. You came out there and you still did face-to-face contact the same as you did before the pandemic started. That speaks volumes for the dedication of the staff. That does not say that agencies who do not do that do not have the dedication. What I'm saying is that it strengthens your credibility with the youth who are out there. All right. Now, what are some of the ways that, I saw somebody mention that they go out to the outreach staff goes out to the food courts. Where are some of the places that you guys do outreach at in the community? Homeless banks, skate parks, libraries, schools. I love the participation. Thank you. Thank you. All right. Libraries, bus stations. I didn't even think about skate parks. That's a good idea. Youth groups, bus stops, yep. Airport. Interesting. Okay. Gas stations, trains. Excellent. When Patrina had mentioned earlier, like when you go out and you do outreach, you should go out in pairs. You don't go out alone, but you also go out and identifying information. So identifying clothing so that they know that you're, the youth know that you're in the community and that you're doing outreach. The Children's Village in New York has a huge outreach RV. I believe it says Streetwise on there. If anybody from Children's Village is on, could you tell me what's on the name of your RV? But this thing is Streetwise. Okay. This thing is a multicolored RV. It's huge. And if you can imagine this thing pulling up into the community, the youth know that Children's Village is there. In Dial South in Massachusetts, they have an outreach worker who literally went off into the woods, into the encampments to provide outreach services to the youth. Now, the thing that impressed me about that is that he's doing outreach services in the community in some of the areas that you guys have mentioned. And he was so consistent, and the kids knew that he was genuine in what he was doing, that they brought him back to where other youth were who were not coming out to get services because they knew that their friends needed help. And he went back into the encampments and provided outreach services to the youth in the woods. I have another grantee excuse me, another grantee that I worked with in Massachusetts, and please forgive me, I'm going to mention the scenario. Please identify yourself if you're on the call. When I went to do a site review, I went to their drop-in center. And in their drop-in center, they had a restroom. And in the restroom, they had different things for the youth to get, such as toiletries, condoms, whatever it is they need. But it was in the restroom. So you close the door, you could discreetly take what you needed to get. What they also had in that restroom was a map of the community. And they asked the youth to like highlight areas where other youth congregate that they were not aware of. The youth were able to discreetly mark on the map where other youth were hanging out at. You know, because they don't want to be known as a snitch. What is it? Snitches get stitches. They don't want to be known as a rat. So that way, it was behind closed doors. They could discreetly highlight the areas, and the staff would then go do outreach in those areas. I thought that was a great idea. You know, we're good at what we do. I've gone to conduct site reviews from as far north as Bangor, Maine, to down south as far as Jersey. And when I first started, my first site review was shadowing one of my colleagues in Alabama. And I've got to see grantees from all over. And I know you guys are excellent in what you do. You're highly qualified and you're dedicated. But a lot of times, oftentimes, we don't have the street credibility that we need to have in order to get through to some of the youth. Some grantees have hired youth with lived experience. All right. Some grantees have hired youth with lived experience. And these grantees have used the youth as case managers, which help to get through to the youth even more. And in doing your outreach, you're going to also provide gateway services. Providing the gateway services, you're providing food, drinks, informational package, different things that you can give the youth in order to help them to reduce their harm. All right. Next slide, please. Harm reduction. And providing the gateway services, you're trying to reduce their harm, whether it's, if you can get them off the street, or you can, give them a positive direction in which to go, some information they may not have had. Harm reduction is just small steps to eventually the ultimate goal, which is to get the youth to safety. All right. Next slide, please. Screening and assessments. What are some of the screening and assessment tools that you guys use when doing intakes with the youth? Okay. All right. And doing screening and assessments, I found a lot of times that the new staff do not understand the why in which you're doing these assessments. All right. You're doing these assessments because you're trying to gather as much information as possible from the youth, so you can then provide the services that they need, not so much as the services that you think they need. All right. You want to make sure that their health is addressed. You want to make sure that, they may not be trafficked. You want to make sure that you have evidence-based assessment tools. That's extremely important. You want to make sure that the tools are covering all bases. There have been many times that I've done a review and I'll see a question where it's, have you ever thought about harming yourself? The answer is yes, but and the follow-up question goes off on a tangent. It's important to use an evidence-based model, because you may have staff that aren't experienced as others conducting these assessments, and it shows them a step-by-step way in which to cover the assessments and the screenings. Right. Next slide, please. Case management, individualized service and treatment plans. You want to make sure that you're using the youth words as much as possible when doing your individualized service plan. A lot of times, certain grantees will have boilerplate responses that the agency wants to have addressed. But again, and being, following PYD, you want to use the youth words, like, what is it that you want to work on? How can we help you? What are the goals that you want to set? When you're setting the goals, you want to make sure that the goals are smart, specific, measurable, attainable, realistic, and tangible. So then that way they can document their progress towards achieving the goal. You know, you want to make sure that the service plans, yep, you even use quotes at times. Okay, you know, that's a good approach. You know, because they know that this is what they said that they want to do. You know, you want to make sure that you have referrals in place and plans for your aftercare. You want to make sure that you're able to. These are goals and which the youth themselves are verbalizing that they want to take on, not something that you're putting in place saying you should this, you should that, and this is how we're going to do. Next slide, please. All right, coordination service plan. All right. We have written it down. Excellent. You have them write it down themselves and make it more personal. That's Cindy. That's a great idea. That's a nice approach. Yeah. And doing the service plans, you want to. It's still along the same lines. You know, you want to leverage your resources. You want to reach out to your community providers and get everybody on board as much as possible. You know, so you can provide a net around the youth to provide them the services that they need. You know, some grantees have network meetings. CHD had a network, and CHD in Massachusetts had a network meeting, and I actually had the privilege of being able to sit in on a site review one time. And during that network meeting, they had all the service providers to the table. Nowadays, you know, we'll probably have to do it through Zoom. You know, we're lightening it up somewhat. We can still meet face to face, but you know, referrals are backed up due to COVID, unfortunately. You know, again, you know, trying to think outside of the box and connecting to different service providers who in your community can help you to limit the wait as much as possible. You know, education plan. You know, projects should have a plan for ensuring that they have connection to the McKinney-Vento liaison and that the liaisons are able to get this youth back and forth to school. I have a grantee now who is having a horror story and dealing with their McKinney-Vento liaison, and that because of the work shortage, there aren't enough bus drivers to take the kids back and forth to school. So the staff have to travel an hour one way to take the youth to school. And we're trying to work around this as much as possible. But, you know, sometimes these things are happening and you have to, you know, whether you go over the head, go over the Department of Education, you know, you have to leverage your resources in order to try to get the plans, completed. Next slide, please. Aftercare. I saw somebody had a question earlier about aftercare. All right. Aftercare. You start planning aftercare at least 3 days after the youth are in the program. You know, it has to be a continuous follow-up for at least 3 months. You have to have 30, 60, 90-day follow-ups when working with the youth after they exit the BCP program. You may have a youth that stays in the program for one night. You still have to provide aftercare. You know, if they stayed overnight, you're providing aftercare services to the youth. All right. You might say, well, I thought I heard the question. Somebody said, well, how do you provide aftercare if you can't get in contact with the youth? Diligent effort. It has to be documented. Social work one-on-one. If it's not documented, it didn't count. A lot of times, you know, people do great work in how and trying to do certain things, whether it's, you know, reach out to youth and aftercare, reach out to the family, whatever the case may be. If you don't document it in the notes, it did not happen. All right. So if you're doing a 30, 60, 90-day follow-up and you aren't able to get in contact with the youth, you're going to show diligent effort that you tried. You know, as part of the aftercare plan, the youth said you could contact me via email, text, phone number, or my mom's house. If you're showing that you're reaching out through all those different avenues that the youth said that they can get in contact with, but the youth still is not responding, you've done your part. You know, it's a shame that, you know, the youth has left, or as they say, ghosted the program, but you can only do what you can do. All right. And in doing so, you just want to make sure that it's clearly documented. All right. Next slide, please. Okay. So that is my portion of the BCP presentation. I'm going to turn it over now to my colleague, Angelica Gutierrez. Angelica, The floor is yours.
Thanks so much, Danny. Danny, you are a hard act to follow. Thank you for all that excellent information. Buenos dias, buenas tardes, depending on where you are in the country or in the Pacific Islands. I see somebody joined us from 3 a.m. out in the Pacific. Thank you, Judith, as well as others. So now I'm the lucky one that gets to tell you the most exciting information on this training. So it's the reporting, the data collection, the admin requirements. Bear with me. This is probably the second or third time that you're listening to it. Maybe it's the first time. So I'm not going to read every single word on the slide because you have that already. The folks from RITAC provided that link, so make sure that you can either follow along here, review it later. I want to provide more context along the way. So just before starting this segment, I know there are a lot of requirements that FISB and other federal programs require by accepting this grant. So we in FISB want to make sure that you fulfill all your grant requirements so that you can keep doing the innovative and critical work that you do while still be able to retain your funding. You can hopefully keep receiving future RHY awards. So that's what I tell my grantees. I'm here to help you keep doing what you're doing and make sure that you fulfill your requirements. Let's see here. So deep breaths, let's dive in. Okay, so the first slide here for data collection and reporting requirements. So two big buckets of reporting or systems that you will engage in as an RHY grantee that you're already engaging in. So the RHY HMIS, so it's the Homeless Management Information System. So grantees are legislatively required to keep adequate statistical records profiling the youth and families that you assist under your grant. So here is a link to the RITAC RHY HMIS page. There's a lot of great resources there. It'll come up shortly from the RITAC team. Make sure that you connect with the point person from your COC's HMIS lead. And the entity responsible, they're the ones that are responsible to making sure that your RHY program are properly set up in HMIS and to provide training to your RHY grantees on how to use HMIS. You enter data for each youth that you engage in your program, either through your emergency shelter and as well as for those that you are providing prevention services. So for those youth and families that are not in shelter, for the youth that are not in shelter yet, but you're trying to prevent them from experiencing homelessness. So in addition to collecting data in HMIS, we also require a quarterly upload into the RHY HMIS repository. I won't be going over in depth into that, but there are some folks on your grantee staff that do take care of that as part of your grant requirements, is that quarterly upload into the repository. So FISB also funds the RHY HMIS help desk, and they are there. They're amazing folks. They know the system. They can help with a lot of the technical questions related to HMIS. RHY HMIS, and especially with that RIPoint quarterly upload period. Touch base with your FPO if you do not have that quarterly upload schedule yet, but we do send out, or the APT Associates team, the RHY HMIS help desk, they send out reminders on when that is coming up. So I believe the next upload period will be at the end of like mid to late April. The next report is the PPR, or the Performance Progress Report. It's due semi-annually. It's due at the end of April and at the end of October. You upload this as a grant note in Grant Solutions. So here you'll report on items such as successes, challenges, overall progress of your BCP program. And in a moment, I will list out a few other outcomes and corresponding measures that you'll be including in that as well. And please, RITAC, just give me a shout out if there's any questions that I should stop for. Okay. So next slide, performance standards. Next slide, please. We went over this information, just a brief recap before we go into the performance standards, so we can go on to the next one. So when we talk about the 4 core outcomes, this is what we're talking about. So when youth are under your care, these are the basic outcomes that we expect grantees to work towards. So for number 1, social and emotional well-being. Question, is somebody on unmute? You can please look down and look and mute yourselves, please. Thank you so much. Social and emotional well-being. So this refers to the social and emotional functioning of youth experiencing homelessness. It includes the development of key competencies, attitudes, behaviors that equip a young person experiencing homelessness to avoid unhealthy risks and to succeed in their life, essentially. Permanent connections. We want to make sure that youth have ongoing attachments to families. Families as defined by youth, and their family can mean their friends. It can mean extended family and so forth, as well as schools, communities, and other positive social networks. Education and or employment. So it includes performance in and completion in educational and training services. So especially in BCP, we see youth under the age of 18. So hopefully they are enrolled in high school or working towards completing high school or their GED, or some of them may also be working at the same time or working towards stable employment. And then finally, stable housing. So meaning making sure that youth, when they're leaving your shelter, they have a safe and reliable place to call home. So go on. Oh, and right, you can please post the link on the core outcome areas. There is a literature review for those that want to take a deep dive into some of the assessments that you can use for measuring these core outcomes. It's a lengthy document, but rich information. So it is there. It's called Core Outcome Areas Literature Review, and it's on the RITEC website. And on to the next slide. Thanks so much, RITEC. Performance standards. So going into social and emotional well-being. So Danny talked about how important assessments are. So assessments are important because you do not want to guess what services youth need. You want to best identify, in this case for social and emotional well-being, what medical, dental, and mental health care needs should be addressed for the youth that come to your doors. The goal is to hopefully provide positive changes in youth from the point that they enter your shelter and after they leave your care. So in addition to assessments, just an aside, you also want to make sure that the youth that you're working with are also expressing that you provide the open door to helping them identify what they would like assistance in. So these assessments help you identify what services they should be receiving, but also, of course, the youth voice is important in developing their case plan. And there are a few resources that I want to provide. Let's see here on the RIE Clearinghouse on screening and assessment tools. So your teens, we heard earlier in the chat, there's a lot of great assessments out there. These are just additional resources to help you identify other assessments that could be useful in your programming. So great stuff there. There's one, as soon as RITEC posts it here in the chat. Thank you for that. This was updated May 2020, so it has been updated, and it has a chart on some of the assessments, what core outcomes they're measuring, just population, description, qualification of staff needed to access the measure, and so forth. So go on to the next one here on permanent connections. So here, I just want to ask a poll here in the chat. How do you help youth develop those permanent connections when you're working on this core outcome? So we all know how important our social networks are. Day to day, we need people in our lives to help us out when the need arises, but also friendships are invaluable to our daily life, mental well-being, and so forth. So how do you, if you have any thoughts on that, and how do you help youth develop permanent connections? Not it's great that they're developing relationships with your staff, but outside of that, in their lives, how do you do that? We provide a prepaid phone so they can contact family and friends. Excellent. Support maps. What other exercises do you do? Mentoring program. You match them with a caring adult, network with outside community connections, volunteers, community resources, employment opportunities, great. LGBTQ groups, the connection scales as one of their tools, excellent. family engagement, family mediation, when even if youth can't return home. Excellent. So you're still trying to build those relationships, even if the youth may not be returning back to their home with their parents. Make a list of 3 adults they could reach out to for help. Great, family mediation. Thank you for that. Okay. We'll go on to the next one, education or employment. So this is pretty straightforward. You'll be reporting on the school status as well as employment status of youth. Since BCP's work with youth under 18, we talked about high school GED completion and so forth. That's very important. All right, thanks for that, James. Family coaching, referring agencies, that's in youth intake, that's for permanent connections. Great. On to the next slide for stable housing. So safe and appropriate exits, it really reflects the intended purpose of BCP as well as TLP. So we want to make sure that when youth are leaving your care, they are going to a safe and appropriate exit. So this can include a private residence of a parent, guardian, or other adult relative, or maybe even another adult that has the youth's best interest in mind, that can provide that stable arrangement. It can be another residential program if the youth's transition to that residential program is consistent with their needs. So we don't want to just say like, hey, you're just going to go into a TLP. It really needs to be consistent with what is best for that youth, especially for BCP youth that are under 18. 3, independent living. Again, this may be more towards TLPs, but there may be situations where that may be appropriate for youth, but we're really thinking that we want to make sure for those underage that they are going to live with another caring adult that has their best interest in mind. So safe and appropriate exits, the safe and appropriate are not exits to the streets or a Locke Correctional Institute or Correctional Center if the youth became involved in activities that lead to this exit after entering your program. So if they're in your program and they catch a case, that is not a safe and appropriate exit for this definition, for this outcome. Or if you don't know where they go, I know sometimes it's inevitable where youth leave and you don't know where they are going. We really hope that that is a rare case, but that according to these outcomes, it is not considered a safe and appropriate exit. Okay, so go on to the next one here. Okay, so the performance standards. This information here, you'll be reporting on the PPR or that performance progress report that is due semi-annually. So for this first measure, you want to make sure that the counseling services you provide and that the youth agree to engage in are responsive to their specific needs, and that they're, whether they're offered in-house or through a referral agency, that they're trauma informed and follow a PYD framework. For the services, the optional services that can be offered through your BCP grant, such as those, I think Katrina went over this, street-based services or home-based services, and or testing for sexually transmitted infections. We ask that you track the completion rate based on that youth service plan. So we're not setting a benchmark for you. This is really based on what is written and what is developed in that case plan for the youth. Okay, go on to the next one, please. So here, so we're going into the sustainability plan. Next slide, please. Okay, so this is something that we in FISB ask for from your agency right from the beginning in your RHY grant application. So make sure you go back and see what's written in there, revise as needed because things change all the time in terms of resources that we have. For organizational health, it's always a smart practice to diversify your funding so that in the event that you are not awarded an RHY award in the future, you're able to continue the critical services, even if it's not with FISB funds, as much as possible. We understand this is not possible at times, but you're planning for that contingency in case you do not get funding in the future. So in the last funding cycle, we especially see this with TLP and SOP, where longtime grantees do not get a grant award. So make sure that even though you've been a longtime recipient, that you are still planning for that. Also, the pandemic has really exacerbated some staff retention, turnover, and hiring issues. This is what we've heard through one-on-one calls with you, group grantee calls, as well as the national training. I do want to point out to a RITAC staff retention information sheet. There is a whole series of these. Thank you, Regina, for posting that. I think this came out within the last month or two. So excellent resource based on the information that RITAC, that we all heard from you, as well as other information on how to deal with what we've heard a lot of you are dealing with, staff leaving the agency, and also being able to hire new staff. And finally, collaboration is crucial. No one person or one program can do everything on their own to support youth. So there's your partnerships with the COC, communication with other providers that serve youth and families experiencing homelessness, the medical community, mental health services. If you can just drop in the chat, let's see here. I want to make sure that I'm getting through everything, but drop in the chat who are your top 1 or 2 partners in the community for making sure that you are being able, that the youth get the wraparound supports that they need. I'm going to continue because I want to make sure I end on time, but we're going to go on to drug abuse treatment. I want to make sure that we get through this information and have enough time for your break. So next slide. Thank you. Administrative and national policy requirements. So again, this is information that is required. The background checks. Okay, so you've heard about the background checks on staff, whether they be staff paid by your agency, contractors, consultants, volunteers that have regular and unsupervised private contact with youth. You want to make sure, and also adults that operate or live in the host home that the youth in your care, that they have background checks. Make sure that you have that you are conducting other checks as required by state law and your licensing requirements. So we do encourage the hiring of people with lived experience. We understand that some folks may have prior histories with the criminal justice system. We ask that you do document the justification for hire, where maybe there has been an arrest or a pending criminal charge or another conviction in the past. Absolutely, sex offender, child abuse records, those are staff that should not be hired. But when there are other charges that may not impede their work in your agency, that really is according to internal policies and procedures. Feel free to touch base with your FPO if this is a question. We'll go on to the next one for emergency prep. Katrina went over this. I think Danny might have mentioned a few things. So we're seeing more and more extreme weather out there. There's wildfires in the west, snowstorms in the east, northeast, hurricane snowstorms, tsunami warnings in the Pacific. Make sure that you do have that plan that you're updating, that all staff and all youth have access to in the case of emergencies. And then there's a few resources that RITAC will post here. Oh, they already did, great. So the preparedness resource page. So when you are updating your plans, please check out these resources on the RITAC page. And then of course the licensing requirement. I think you've already, Katrina mentioned this earlier. So make sure that you are compliant with that. So the next slide for your training plan. We want to make sure that all staff and volunteers that work with youth are trained on those core competencies of youth workers. Here is a link to the RITAC required training. Check that out in case you are, again, you're updating that training plan for onboarding new staff, as well as ongoing training that your team should be getting throughout the year. Okay, next slide. technical assistance, monitoring, and short-term training. So this is not a monitoring training, but know that within the life cycle of your grant, your FPO will be doing an on-site or virtual monitoring. Also, your FPO will provide ongoing TNTA. We have the regional trainings in May. They're not happening this year because we're holding this program-specific training this year. But next year, we may be having those regional trainings. We have the national training in November that this year will be held virtually. And there's a guide to TA on the RITAC website as well, in case you need more hands-on or intense TA with certain program areas. Thank you, Regina, for that. And then the final one, confidentiality. Any PII, personally identifiable information, should be protected of your youth. So policies and procedures should reflect these confidentiality protections. And all youth also have the right to review their records, correct a record, maybe file a statement of disagreement, and also know who else has viewed or has access to the records. You know, we document so much of what happens to our youth day to day. Partially, you know, we want to make sure that all services are being documented, but also you have the right to know what is being documented, what is being written, and who is seeing this information. I'll stop there, and I will, well, thank you for bearing with me through all this information, a lot of information in a short amount of time. Please review this, touch base with your FPO in case you need further clarification, and we may be answering a few questions, and I'll turn it over to Gloria now. Thank you.
So thank you all so very much. To my esteemed colleagues, you all have done just an outstanding job in being able to articulate the information, even sharing examples. And I don't doubt that the information shared will help our grantees in continued success and execution of their programs. And so we have embarked upon the second phase of our training. So if we could move forward to the breakout group section. Yes, so in order to provide you with continued information that will certainly help with the execution of your programs, we reached out to various programs and sort of to assess where your needs were. And overwhelmingly, the discussion was around aftercare. And so with that, we will be having our breakout sessions. And if we could put the question up on the screen, that will be helpful. So Danny, as well as all of the other presenters have made reference to aftercare piece, so I won't go and read that, but we know that there is a requirement for 3 months beyond the time that these young people exit the programs. So the question is, with the youth and our families that you have been able to successfully engage in aftercare, what has worked well, and why do you think this engagement has worked? Again, with the youth that have been successfully engaged, or that you have been successfully engaged with, what has worked well, and why do you think that this engagement has worked? And so what we have decided to do to further support that discussion, we want, or we're asking for you all to participate by responding to 2 poll questions that will be up momentarily. But in that, as we transition to our breakout groups, I wanted to share, you know, we're really all excited. I have on a really bright lip now, you all. I didn't have that on before. I have these bright nails here on now. And that's because, you know, the energy that we're going into our breakout session with is enhanced, because we have the benefit of having grantees in all of our 10 breakout sessions that have been very successful in implementing the aftercare program requirement. So we have the benefit of being able to hear some of their best practices. So we're really excited on this end. So as I transition and turn this over to RITAC so that they can put up the poll questions and give you all some additional guidance around transitioning to your breakout rooms, please make certain that you're turning on your bright lights, your phone lights, all of that, your flashlights, every bit of it, because the session is going to be fire. Okay, so I'm going to turn it over now to John McGaugh. John?
Actually, it's going over to Diamond.
Okay,
Thank
well,
you.
Diamond then.
Thanks, John and Gloria. Hello, everyone. My name is Diamond Dumas, she, her pronouns, RITEC Training and Capacity Building Associate. I'm so happy to be with you all today. Our first poll question is going to come up on the screen right now. Perfect. And so this asks about youth participation. How would you describe overall youth participation and aftercare services? So quickly go ahead, put in your selections, whether that be excellent, good, average, fair, or poor. And when we get to about 60 to 70% answered, we'll go ahead and show those results. Awesome. So it seems like a majority of folks are saying average. That's totally okay. We'll be doing more conversation about this and how to increase aftercare during your breakout sessions with some grantee facilitators. So with that in mind, I'll go ahead and pose the second poll question, which is, what is the primary method of delivery for aftercare services? Whether that be email or social media. We heard a lot about that from Danny's presentation, telephone or phone calls, whether that be in-person, one-on-one contact or in-person group contact. Again, trying to get 60 to 70% response rate here. So feel free to go ahead and answer. Awesome. So it's looking like a majority of folks here with 69% are having those conversations via phone. All right. Well, thank you so much for participating. Those responses are going to help fuel the discussion later on after your 15-minute break. Again, as Gloria mentioned, get out your flashlights. We're going to be illuminating this conversation in our breakout rooms, but feel free to take a 15-minute break to answer your emails, get up and dance, or do whatever it is you need right now. And when we come back, we'll be excited to talk about this conversation with you all.
All right. We want to welcome everyone back. Hope you enjoyed your breakout group. A lot of good information was shared on the one I was on. I really enjoyed it. And my name is Keith Wallace, and I'm a RHY Regional Program Manager. I'm currently based in Dallas, Texas, and I work regions 1, 2, 3, 4, 6, and 7. And I saw some chat about enjoying the music today. And I can tell you, I was in high school in the late 70s, so much of this was music we listened to frequently. So I just want to tell you why we are sharing some of the music with you today right quick. We opened up the training today with One Nation Under a Groove, which was a big hit for Funkadelic back in '78. And this song was all about bringing people together, especially through music. And that's why we selected that song to start out our day. Then you heard Flashlight earlier by Parliament, and that's just a great song. I don't know how you can sit still with that one playing. And it's about how we're all equal and we can use our own flashlight to help draw others in and bring people in for unity. And what you just heard just now, I saw several people asking, it's a song called Celebrate, and it's by a group called Rebelution, R-E-B-E-L-U-T-I-O-N. And it's a song that reflects the spirit of what all of you do for youth every day, which is you celebrate their individual uniqueness, and you have their backs even in the worst of times, and for that we thank you. Later on, you will hear the last song of the day when we close out by Bob Marley called One Love, and we chose that as a closing song because Bob is singing about his prayer for love and unity for all the people of the world. But now it's time to hear some of what was shared during the breakout sessions, and so I'm going to call on a couple of federal project officers to get us started, and we're going to start with Alicia Parks. And would you please let us know what was shared during your breakout?
Hello all, thank you, Keith. My name is Alicia Parks. I bring you greetings from the Peach State. I am a federal project officer based in Region 4, the Atlanta, Georgia office. First, I just want to say thank you to Debbie Alford from Caring from Children in Asheville, North Carolina, a program of Eckerd Youth Alternatives for co-facilitating the breakout session with me. And thank you to all of the participants of the breakout group, group number 1, for the robust discussion. They shared a lot of different effective strategies for aftercare. I just want to highlight a few. The main thing that came across from the group is the importance of one-on-one engagement with youth, which I thought was interesting when looking at the poll question, where the one-on-one engagement was relatively low, but in this breakout group, the people who spoke up stressed and emphasized that they prioritize one-on-one engagement. And what that looked like would be home visits. They also, they would conduct home visits with youth. They also offered groups that the youth could attend, groups such as life skill groups, LGBTQ plus groups, a basketball program that offered mentorship abilities. There was a grantee that spoke of having an aftercare case worker, case manager, so someone who was worked specifically with aftercare. In addition to one-on-one engagement, in-person one-on-one engagement, a grantee noted that virtual events also was an effective strategy for aftercare. For those virtual events, they offered incentives for you to participate by offering gift cards or having a gift pack for the youth. And for those virtual events, it will be through just random selection. Youth would enter their names into the chat and they will select a participant to win, to receive those awards. Also, the group spoke about just non-traditional ways of connecting with youth. A lot of the participants spoke about just developing and cultivating a relationship, a positive relationship with youth. And they did that through, non-traditional ways, or just like going out on walks. Like the meetings did not necessarily have to occur in the shelter, but going out for a walk or in a car ride. They thought of different ways of connecting with youth. So those were a few of the things that were highlighted in group number 1. Not all, again, thank you, group 1. I will pass it back to you, Keith.
All right, thank you so much, Alicia. Next up, let's hear from Sherry Boyd. And please introduce yourself, Sherry.
All right. Hi, everybody. I'm Sherry Boyd. I am an FPO, new to RHY, a year and a half, Region 6. Woo! I love Region 6. So we had a great time, and I think we were group 9. Thank you so much, Ella Nimmers from CYC in Monroe, Louisiana. She helped me. My internet was mad at me and kicked me off, but she just ran things really smooth. So the things that I was able to capture, and she could follow up with me if she wants to, but like group 1, relationship was very important. And some of the grantees, there was one, Shadesha, and she was talking about once a client came in, they were very mindful of who that client connected with, and they wanted to try to maintain that connection. So it wasn't always just a case manager that would do the, follow up and aftercare. The aftercare but they would have a direct staff if that is the person that the client was connected with. So they really emphasize that relationship piece of that. They also spoke, I believe they were in, it was in Tacoma. And so they invited their clients back to be in the youth leadership as mentors. They had like events that they would invite them back to, a community. They wanted to make sure that they always knew that that was their second home, that they were there. And I believe Ella says, when a youth comes into their door, they said, we're always going to be family. We're always going to be part of your family. Let's see. Rachel from Maine in New Beginnings, she said, at first they struggled with the new definition because the requirement now is a little bit more difficult to accomplish. But one thing that they've had success with was with the connection and getting them into the leadership roles as well. And Ella, I think that's where I bounced out. So let me know if I missed anything with her. Steve Parker from ACH, they said that their organization and along with the rest of the group, at least half of the group provided care beyond the 21 days because they were having, if they believed that the client needed more, or they were having a difficult time placing that individual in a safe exit, then they would extend that. And they said that they would ensure a solid transition with that exit plan. And the outreach coordinator, they were very intentional in trying to get their after services, those services, close by to the clients because some didn't have transportation and transportation was an issue. So they tried to make, the low barriers for the services that are provided for aftercare to increase the chances of them participating. Let's see. Emmy said they have an ambassador program and they just admitted as well that, they struggled with that. It was hard. And I really appreciated the transparency of our group because we're not going to get better unless we say, we're needing some services, we're needing some things beefed up. So I did appreciate that. Rachel mentioned that they use Messenger still because some of their clients say that is something that they are able to access, even though they're not on Facebook, they use Messenger. And they even do set up appointments that the clients are more apt to use that to set up appointments, to do video calls through Messenger. Since some have to go to different places to get on service, they may not have phone, but they have Wi-Fi available. Let's see. And again, emphasizing connection from the moment they arrive. And last, there is a life skill Ella shared with our house. They use TikTok to do some of their life skills, teaching cooking or teaching any kind of skill. And that's been pretty successful. And she was nice to share that. But one of the things that I heard a lot of the grantees are having a challenge with that I wanted to speak out was Department of Health Services, CPS, they are less inclined to do an investigation for the children and youth. So it's hard for them to put them in CPS and CPS take over because they're holding back and they're not making those investigations. And this was nationwide that we heard in our group that this is a struggle that the BCP's grantees have had. So we don't have an answer to that, but I just thought that was interesting enough that we should have that voice and share that with the group. So thank you guys for allowing us to share.
All right, thank you, Sherry. So at this point, are there any other federal project officers that had something different that your group shared other than what we heard from Alicia and Sherry?
Keith, this is Janice in Region 10, and I know that Kendra's on screen. And Kendra, I'm wondering if you could talk about the Never Give Up bag.
Absolutely. So one of the things that we shared in our group, group 5, I believe, was that our shelter manager, Salvador Maciel, who's also on the call, was really having a hard time with how youth arrived to our program and sometimes how youth had to leave from our program in terms of what they came with. Many of our youth, as some of you might know, come with their stuff in trash bags or garbage bags or broken bags or just handfuls in their arms. So we worked with a local service group to build what we call Never Give Up bags, and they're really durable canvas duffel bags that are filled with all sorts of cool things to help a youth feel accepted, comfortable, welcomed, celebrated. There's gift cards, there's snacks, there's planners, all sorts of things that can help with their success after leaving a program. And on the outside of it, it's embroidered Never Give Up. So each youth that exits our program exits with a Never Give Up bag. So they get the treats inside, the bag itself, and the reminder that they should bet on themselves, and we're always here to support them if and when they need it.
Thank you, Kendra.
Hey Keith,
Thank
this
you
is
so much,
Jesse
Kendra.
in Region 3. I wanted to see if Tom from Salvation Army in Syracuse could just share a little bit about our conversation, maybe specifically about staff and how they engage with youth in different programs. I thought that was helpful.
Sure. Hi, Jesse. Group 6 was great. I just want to say that. And one of the things that we discussed a lot, many of the programs felt that it was really important to get all hands on deck involved in the aftercare process. So it's not just, doesn't just fall on the case manager, so to speak. So even the weekend person or the overnight lady, making a connection with a kid, and then later using that person, using that strong bond that they made to keep the aftercare going and alive. We saw several programs that said that they used other staff to help make contact with kids throughout the aftercare process. One program even was able to slide some funding and create a specific aftercare position where they did some fundraising. It was so important to them that they wanted someone specifically assigned to carry the aftercare banner out into the community. Well, a couple of programs was a really great idea. They have open house hours. They just drop-in hours at the basic center where other kids who have stayed there in the past can just stop in, you know, kind of like your own children stopping by your house. They don't need an appointment. They just stop in, see what's in the fridge. And that same concept of just, you are part of our family regardless of when you actually stayed at the basic center. So if you stayed at the basic center in January and it's time for a harvest party, we're still going to invite you to the party because you are family now. And even though the 90 days of aftercare has expired, you're going to come to our party because you're part of our family now. And then the final thing that we all kind of really stressed was that getting family involved to some degree is just so incredibly important, even if it means bringing some giveaways or some gateway kind of things to the family's house. We had one program that was able to bring a box of food during the COVID situation, and it just helped break down some of the barriers, particularly with a program that had to report that family to CPS. So having your aftercare bearing gifts whenever possible seemed to be popular. Jesse? Did I do okay with that?
Yeah, that's great. I'll
Great, thank
hand it
you.
back to Keith to see if there's anything else from other groups.
Hi,
Thank you,
Mr. Wallace, may I share just a few brief things? And I feel terrible not including because Group 4 had so much to offer. I can think of one thing. Is it okay for me to share something?
Yes, please.
Yeah. Cindy from Children's Village spoke to the Youth Advisory Board, and she spoke of aftercare program is made up of youth who are part of the aftercare program to allow the youth to have a voice, talking about what they experienced while they were in the shelter. Youth speak to lived experiences and what they want to see at the shelter, critiquing the program and what could be better, giving youth a voice to feel a part of it. The aftercare case worker who meets with family to address youth's needs that may include school or mental health. And there was something that I particularly cared for where one of the grantees spoke to if a youth, let's say their phone minutes are lost, they use Facebook. And more than one grantee said this, and they do messaging on Facebook. They get families involved to find out what the family dynamics are. They get the family in the service plan so that the youth could be successful. So one of the grantees asked, well, are you concerned when you go to the family's house by reaching out to the family? They said they have a safety plan involved. There's a buddy system, and they share their location with their supervisor. There was so much. I'd like my co-facilitator to share some things with us also. If you could, Valerie, please.
Sorry, what? Were you talking to me, Asita?
Yes, please. You are my co-facilitator.
Sorry.
Oh, well, could you share some points on aftercare? Could be some key points that you think were brought out or you would like to share with the group.
Yeah, I think people have talked about them, and you really hit on the one that really stuck out for me was the Youth Advisory Board, using the youth who come to the shelter and setting that up as a continuing, ongoing routine thing that youth can count on to come back and give feedback. A lot of folks talked about mentorship programs, talked about connecting with Job Corps, and then really echoing the idea of that relationship, the trust-based relational interventions. Somebody mentioned Love and Logic. So that was definitely a theme about establishing a really respectful, caring, kind, trusting relationship with the young people. So they want to reconnect.
Okay, we don't want to take up any more of your time, Mr. Wallace. Thank you so much, Valerie. I pass the baton back.
Thank you, Asita. I want to thank everyone for your participation today. I hope you will leave with some new information, maybe connected with some folks where you can help one another with best practices, and for helping us today to make this training a success. But now I want to turn it over to John McGaugh with RITAC, and he's going to discuss training evaluation.
All right, thank you, Keith, and thank you everyone for sharing. Most importantly, we are just dropping in the BCP playlist, the Spotify playlist with the songs that Keith listed out from today's training, if you're interested. But I'd like to get your attention before we wrap up to the evaluation for today's training. So the training is being put in the chat room. So please, if you could click on that, indicate that it's a virtual training, which training you're part of, the BCP grantee training. It'll ask you about your role, your region, and then about 5 questions, multiple choice, and then a couple of questions about how could this be improved moving forward. FISB and RITAC really look at this feedback and take it seriously. So we will look at it. We really ask you to make sure you complete that. Just click on the link and you can submit it online. So thank you for doing that. And thank you for the BCP training team led by Gloria Watkins and the FPOs that are part of that team. We were happy to work with you. Okay, with that, I'd like to hand it over to Dr. Sanzana Dean for some final remarks and to close us out. Dr. Sanzana Dean, as you probably know, is the Director of Runaway and Homeless Youth at the Family and Youth Services Bureau. And I'll hand it over to you, Dr. Dean.
Thank you, John, and good afternoon, everyone. I just want to take a brief moment to thank you all for joining our training today. Also, a thank you to Associate Commissioner Waller for the welcome and sharing FYSB's priorities. They really guide the work that we do here at the federal level. As the third offering in our program-specific training series, I really hope that you found the training to be useful in building knowledge about the variety of program requirements for implementing your BCP program. As I mentioned in some of the previous trainings, FYSB developed and designed this series in response to feedback we received during the 2021 new grantee orientation, where grantees noted in the evaluation that while they appreciated the feedback and the information, that they really wanted an opportunity to take a deeper dive on the program requirements and learn more about strategies for serving young people in their programs. And so please know that we do listen. And we always look for ways to offer new and engaging training resources. I've truly enjoyed being a part of the sessions and the breakouts today. And I continue to be proud of the work that you do every day, supporting young people experiencing homelessness in your communities. It's evident in the robust discussions and the sharing of resources with your colleagues that you have a strong sense of passion and commitment for this work. And I saw firsthand just discussions on the many ways that you go above and beyond in developing resources and supports for young people. I've made note of several of them, which I will, keep in mind and share, but I really liked hearing about the Never Give Up bags, the aftercare parties. Even once young people leave your programs, they have the opportunity to come back and maintain those permanent connections to the staff and people that they feel really believe in them and have their back, so to speak. I also like hearing about the youth-led TikTok life skills training. And so if we have an opportunity to get that link from our colleague in Louisiana, I'd love to view those videos and share them as well. And so with that, I'd like to thank our grantees who dedicated your time to join the training today, but also for your willingness to share the best practices and strategies with your peers across the country. I also appreciate Youth Collaboratory and the RITAC team for your support in implementing the training and the continued support that you offer to our grantees. Several resource links have been provided in the chat today, and I really encourage you to visit the RITAC website as well as the Clearinghouse on Homeless Children and Families website for additional resources that may be of value to you in implementing your program. And before we close, I'd lastly like to acknowledge the tremendous amount of work that went into the planning and development of this training over the last couple of months. To the RHY team and the BCP work group, I truly appreciate your vision and efforts to bring life and energy into this training. As you guys may have noticed in watching the number of participants, we had over 600 participants who were fully engaged in learning and sharing, and it's been truly outstanding. I know that Gloria, we owe you a standing ovation for that song this afternoon, and I absolutely echo the feeling of one team and one vision for strengthening our collective capacity to really improve the lives of young people experiencing homelessness. I thank you all for your energy and for your support and your willingness to continue to be a part of the conversation, both at a local community level, but also informing the work that we do at the federal level and the national level. And so with that, I will close today's training on a very high note. I encourage you to complete the evaluation and to join us in the final installment of the program-specific training series on Thursday for the Maternity Group Home program. I wish you well. Please enjoy the rest of your day. Thank you, everyone.